up here. What scars will you be left with after a breast reduction? Thank you. So they do vary, the scarring. Now, pretty much all breast lifts, I say pretty much, I think probably all, I think I would say all breast lifts, all breast reductions involve a lift. So if you're going to reduce the volume of the breast, you're going to tighten the skin envelope as well as reducing the size of the breast. You kind of have to tighten the skin. If you just reduce volume and didn't tighten the skin, they'd sag even more. A bit like going back to the buttock thing. If you just take volume out, if you just do something like liposuction, for instance, to the breast, and just take volume out, you're going to make it sag more. So you, as well as taking volume out, you've got to take skin out. And that's going to cause scarring, scarring on the skin. And the lift involves moving the nipple up to a higher place and tightening the skin envelope. So it's always a scar around the nipple because you have to move the nipple. So that's a given. And there's usually a scar that goes vertically down from the nipple. And in my practice, that's kind of the minimum. And I would usually also put one in the fold of varying lengths, the horizontal one. Now, some people, and someone recently was asking me about having it with just a circumareolar scar, with just a scar around the nipple. And again, scarring is not good. And if we could use less scarring, that would be better. The problem with doing less scarring is you take less skin out and you get less of a result. And in my hands, just putting a scar around the nipple for a breast reduction does not give a good shape to the breast. The scar's always puckered because you're like taking a donut of skin out to tighten the skin. And you're making a big circle into a small circle. So the scar's puckered. And it doesn't give good projection. It kind of flattens the breast and it doesn't give good projection. So I don't particularly do that one. Some people will use the vertical scar quite a lot, so around the nipple and down. But I pretty much always put a scar in the fold as well, a horizontal scar in the fold as well. If you're just doing a circumareola around the nipple and down scar, then the down scar allows you to take skin out in a side-to-side direction. If you're just doing a circumareola, you're just bunching the skin up. If you could do, once you put the down scar in, that means you can narrow the breast and take the skin out in a side-to-side direction. If you then put a horizontal scar in as well, so-called anchor or T-shaped scar, then you're taking out skin in an up-down direction as well as a side-to-side direction, and that can give a better shape. And the problem, particularly if you've got a lot of skin, if you don't do that horizontal scarring, you worry about getting folds and things. And they say they do settle, or they might need to be revised at a second stage. But I think it's better to put that horizontal scar in personally and give a better shape. So the scarring for breast reduction for me is around the nipple, vertically down, and then also in the fold where your bra sits. Inverted T-shaped scar, anchor scar. Try and make the T as short as possible. So try and make the horizontal scar as short as possible. But the bigger the lift, the more skin you've got to take out in an up-down direction, the longer the horizontal scar. So always try and make it as short as possible. But to be honest with you, out of the three, the horizontal scar is probably the one that's more obvious if you look at it, but you often can't see it because it's kind of hidden in the fold. And the ones at the top, the sort of the one round the nipple and down, are a bit more obvious.